Okay, so removal wise, we've talked about obviously getting out the bladder and the prostate, nerve sparing when feasible in men. In women, it sounds like gynecologic organ sparing in the appropriate selected patient is a consideration. And that's certainly been my sense as well, that kind of the whole steady in pelvic exent is maybe not best for everyone. I certainly saw a fair amount of young female patients, just kind of anecdotally, a lot of them of Hispanic origin in Dallas that were still interested in having children and so forth, and organ sparing was a part of the armamentarium, and I do think that you're starting to get into some low incidence scenarios now, organ sparing female neobladders, and my opinion is those should probably be taking places at centers that do quite a bit of these operations. Any kind of thoughts on centralization for bladder cancer care?
Yeah, I think absolutely it's ideal. I think there's plenty of literature out there to suggest that there's less complications, morbidity, mortality is one third at high volume hospitals than lower volume hospitals. But look, it's difficult. I think it's going into a whole other discussion of centralization of expert care, which is oftentimes not possible in Southern California. And I think you'll see the difficulties here. There's so many of these managed care organizations that just don't allow patients to go seek that the expert care, and many of these cystectomies and things are done at low volume centers at low volume providers. And I think honestly, it's a disservice to the patient. These are patients who can be well served in multiple institutions that are around in Southern California and beyond. So I absolutely wholeheartedly agree with the centralization of care for these difficult, complex cases such as bladder cancer. But in reality, especially even when the patient has good insurance, I think the logistics of coming back and forth to a facility that's a few hundred miles away is difficult for bladder cancer. Older patients, mobility issues, ride issues, and the back and forth, and especially that various complications that happen. You'd want the patient here. So these are challenging.
Yeah, no, I think they are challenging, and certainly a center like USC, which I think is known for having fairly ultra high rates of neobladders, is going to be kind of a testament to when you're at a place that does a lot of you could say a complicated operation, and maybe you're augmenting with the slight increased bit of potential for complication with the neobladder. These should be done by people that do a lot of them.